One second. Yeah. Today we are going to discuss about the a very interesting topic called as oral hamartomas. To understand this exactly, what is all of us, you might have heard of this word hamartoma, choriostoma, teratoma. These are all very common. Now, hamartoma is one such word where this term hamartoma is derived from the word hamartia, referring to a defect. Hamartia means referring to a defect. So, it is a Greek word. Originally, this word was coined by a scientist called as Albrecht. This is not that important, but what is important here is its definition. I'm not asking you to by heart this definition, but understand the concept behind that definition. This definition will tell you everything about hamartoma. What exactly is hamartoma? It is non-neoplastic. That means it is not a benign, neither a malignant tumor. It is non-neoplastic. It can be defined as non-neoplastic, unifocal bar multifocal. What do you mean by that? It can be either a single lesion or a multiple lesion. Developmental malformation. It is developmental. Okay. Developmental malformation. That means abnormality. Comprising a mixture of cytologically normal mature cells. The word is important here. A hamartoma is not made of any abnormal cell. It is made up of a normal cell. And tissues which are indigenous to the anatomic location. What do you mean by indigenous? Indigenous means a hamartoma is located to that in a particular location, anatomical location, which is supposed to be there only. Indigenous. Showing disorganized architectural pattern with the predominance of one of its components. So here, what are the points to be remembered here? A hamartoma is non-neoplastic. A hamartoma can be unifocal or multifocal. Hamartoma is made up of normal mature cells. And hamartoma is located native to the place. Native means, for example, wherever the tissue is there, normal tissue, it will occur in that area only. For example, skin. So hamartoma will be seen on skin only. Like we have seen something called as exactly opposite of this is choriostoma. What is choriostoma? It is not native to that place. Like for example, sebaceous glands you will see on the skin, not in the oral cavity. If you see it in the oral cavity, it is not a native place. Then we call it as a choriostoma. So that is the definition of a hamartoma. Now, after knowing the definition of hamartoma, there are few hallmarks. The same definition has been listed as a certain hallmarks. What do you mean by hallmarks? These points should always be there. It is a developmental malformation, may be present at birth, but manifests later. That means it may be present at birth. It may be present at birth, but manifests later. May be present at birth. Understand this the word. They are not saying it is always present at birth. It is may be present at birth, but manifests later. Self-limited growth. It is not continuous growth. Self-limited. Slowly growing. coordinated with that of surrounding tissues. Suppose a hamartoma is there, the skin around that or tissue around that, whatever the rate at the tissue, the surrounding tissue will grow, hamartoma will also grow at that same rate. So it has got a controlled growth. Can present as a solitary or multiple masses. That is what we have seen. Unifocal or multifocal. It may regress spontaneously. That is the important of hamartoma. Understand this. Hamartoma, sometimes you don't need any treatment. It's not like all hamartomas will not require treatment. Some hamartomas, they will regress on itself spontaneously. They're usually not encapsulated with ill-defined margins. That is a point you have to understand. Normally what happens is, see, all of us know a benign tumor and a malignant tumor. Malignant tumor doesn't have any capsule. It is not encapsulated. Whereas benign tumor is usually encapsulated. Hamartoma has got one feature which is like a malignant histologically. It will not have that capsule. Okay, but remember, it is not malignant. Neither it is benign nor it is malignant. It is actually or totally non-neoplastic. It is not a true neoplasm, but a true neoplasm may develop in a hamartoma. Please understand this. As such, hamartoma is non-neoplastic, but a hamartoma can get converted into a neoplasm. Microscopically, it is composed of normal mature cells native to the anatomic location. So it has got normal mature cells. Okay, I hope you understand this. All these are the important hallmarks of the hamartoma. So we have seen what is a hamartoma, what is the definition of hamartoma, what are the hallmarks of a hamartoma, what do you mean by hamartoma, hamartia, from where it has been derived, who has coined this term, Albrecht. Now after knowing that, let us understand certain classification. So here we have to understand that broadly we can divide hamartoma based upon the tissues. All of us know that we have 4 basic tissues in the body: epithelial tissue, connective tissue, right? The nervous tissue, the muscle tissue. In the connective tissue, bone also is included. Blood vessels are included. Okay. Now here, epithelial tissue. If I take epithelium, I will divide that epithelium into non-odontogenic and odontogenic. Non-odontogenic and odontogenic. Non-odontogenic means what? Which is not related to tooth. Which is actually not related to the tooth, or not occurring in the tooth-bearing areas. That is, it doesn't occur in the jaw. It will not occur in the jaw. Sorry, I'm not well. Okay. So here, basically, what we have supposed to understand here is that the hamartoma of non-odontogenic origin example is nevi. All of us know about nevi, right? Nevi are hamartomas. Understand this. Nevi are hamartomas. So nevi can occur usually on the palate, or they usually occur on the palate. Based upon the different type of nevi, different locations are there. The most common location is the palate. So nevi is a classical example of the non-odontogenic hamartoma. Now understand here. One thing what I have told you, nevi will regress. Hamartomas will regress spontaneously. Now you can ask a question. Nevi has got different types of nevi. Basically, broadly, I'll not go into details of this. Intramucosal nevi. There is one type of nevi called as blue nevi. There is one type of nevi called as junctional nevi. Junctional nevi is the one, even though it is a hamartoma, it can get converted into melanoma. That is what is this. This is the, you can see here the point. Not a true neoplasm, but a true neoplasm may develop in a hamartoma. So a junctional nevi can get converted into a melanoma. So junctional nevi won't regress on its own. So whatever are these characteristics, usually they are not applicable 100% to all. At least few are there, then it is hamartoma. So that is why they have given may regress spontaneously. They are not given they always regress. It's not like they always regress. They may regress spontaneously. Okay, that means they might not usually require treatment, but some hamartomas might require. For example, junctional nevi, what we have discussed, because it is very risky, very dangerous. It has got a high risk. It can get converted into melanoma. So obviously, surgical excision is mandatory for junctional. Okay. Now, moving on to the hamartomas of odontogenic origin. Now, in this hamartomas of odontogenic origin, that means related to the teeth and jaw. So, some which involve the teeth, some which don't involve the teeth. Some which involve the teeth. Actually, this classification, some books don't accept this. Some authors don't accept, but this is a recent classification given by WHO, where WHO says that developmental disturbances of teeth like dense invaginatus, enamel pearl, and talus cusp also should be included as hamartomas. They should not be called as a developmental. Actually, they come in developmental disturbance of the teeth, right? They come in development under the group of developmental disturbance of the teeth, but actually they have to be truly called as hamartomas. They should be truly called as hamartomas. Now, what are the hamartomas which are not involving the teeth? Very, very important. Understand this. Now, what are the hamartomas which do not involve the teeth? What are those? Number one, adenomatoid odontogenic tumor, AOT. All of us know AOT, also known as two-third tumor. Why AOT is known as two-third tumor? Because two-third of the cases occur in the anterior maxilla. Two-third of the cases involve the impacted canine, maxillary canine. That is why it is called as two-third tumor. AOT is a hamartoma. It has got a very limited growth potential, and its size is also very restricted, small. And if you excise it also, it doesn't recur. It's not. It's wrong to say that it doesn't. 90% of the cases doesn't recur. Okay, recurrence is very rare. You can say 99%, not 90%. 99% won't recur. That is why AOT is described as a hamartoma. Similarly, SOT, squamous odontogenic tumor, which is also an odontogenic tumor, is also now called as a hamartoma, not a odontogenic tumor. Okay. Amyloblastic fibroodontoma. See, please, I'm sorry. This amyloblastic fibroma should not be there. Let me cancel this for you. Let me cancel this for you. This actually, I'm really sorry. Amyloblastic fibroma is not. There's a typing error here. Okay, so amyloblastic fibroma is a true neoplasm. It is not a hamartoma. Amyloblastic fibroodontoma is basically a hamartoma. Amyloblastic fibroodontoma is a hamartoma. Odontomes are also hamartomas. Odontomes are also hamartomas. So basically, which are the odontogenic tumors which are the hamartomas? They are actually not a true neoplasm. Is AOT, SOT, amyloblastic fibroodontoma, and odontomas. Okay, done. Now, What are the hamartomas of connective tissue? Now we have the basically the hamartomas of connective tissue, mainly the bone or the osseous tissue, fibrous dysplasia. All of us know fibrous dysplasia is a developmental malformation, developmental condition basically, which affects maxilla. So fibrous dysplasia is now classified as a hamartoma. Exostosis. What do you mean by exostosis? Exostosis is nothing but extra bony tissue or a bony mass. Extra bony tissue or a bony mass is known as exostosis. So that exostosis is also considered as a hamartoma. Hamartomas of vascular and lymphatic tissue. Your hemangioma, lymphangioma, all of us know about hemangioma, lymphangioma. They are basically again a hamartoma. Hamartoma of neural tissue. Some books controversial, again I would say rather forget this, or this is bit controversial. Actually it is some it is neoplasm, but WHO somehow has classified that as a hamartoma. So they say usually it's better, because they won't ask you in the exam such controversial things, too much controversial things. So you can leave this also. So neurofibromatosis or von Recklinghausen's disease is considered to be one of the hamartomas. Is considered to be one of the hamartomatous tissues. So basically the hamartomatous tissues of the connective tissue we can classify as bone, vascular tissue, neural tissue, and then next we have the muscle tissue. So muscle tissue we have, see, don't get confused. Leiomyoma is different. Here we have oral leomatous hamartoma. That means the hamartoma which involves the smooth muscles in the oral cavity. What is leiomyoma? It is the leiomyoma. Leiomyoma means anything related to smooth muscles. Rhabdomyoma means anything related to skeletal muscles. Here, oral leomatous hamartoma is a hamartoma which involves the smooth muscles of the oral cavity. Oral rhabdomyomatous hamartoma means it is a hamartoma which involves skeletal muscles of the oral cavity. Congenital granular cell tumor, which is also known as Arbikosoff tumor, which is also known as Arbikosoff tumor. Congenital granular cell tumor is also known as Arbikosoff tumor. This is again basically a hamartoma. This usually occurs on the tongue. Lastly, there is one hamartoma which is associated with a syndrome, that is a Cowden syndrome. Cowden syndrome is also considered to be a hamartomatous syndrome. This could be one of the potential MCQ. Please remember this. Okay, so because this Cowden syndrome, in these patients of Cowden syndrome, what usually you see in Cowden syndrome? Usually what we see in Cowden syndrome is multiple papillomas. It is also called as papillomatosis. However, these patients of Cowden syndrome will also have multiple hamartomatous lesions also. Multiple hamartomatous lesions also. Okay. So that is an overview. I have given you a classification. See, I'm not going to tell you the details of this here. In this session, we have seen about the definition, meaning of hamartoma, what are the hallmarks, and basically the classification. So here sometimes what happens is usually you get MCQs based on this. Which of the, usually this is the very interesting, or I can say this is the one highlight usually asked as MCQ. Which are the odontogenic tumors which can be considered as a hamartoma? And this oral neva is also very frequently asked. Whether oral neva is what? Benign tumor, or a reactive lesion, or a hamartoma. Exactly that way the question is asked. Okay. So any doubts are there, please let me know. Otherwise, we'll conclude for today's session. And next we will have next session based upon the other. I'll take some important topics like this, which are usually asked in the exam and which are not usually present in the textbooks. Okay, so this you won't get in the textbook. No textbook will give you about the hamartomas, but MCQs are asked in different entrance examinations. Okay, thank you so much.